because the work that we do is stressful, can get stressful, and a lot of people don't know the stress that we carry. But so we're not going to do heart, mind, and body, but we are going to do introductions. For anyone that doesn't know who I am, I'd like to let you know my name is Sherelle Snyder. I am a community organizer here at the East Trenton Collaborative, and I am also lead advocate for our lead-free New Jersey Trenton hub. There's 4 hubs in the state of New Jersey, and Trenton is one of the hubs. And we're here to assist and here to help. And I guess we could start in this room because I want everyone to meet my newest coworker, my partner here at the collaborative, Enrique. Go ahead.
Hello, everyone. My name is Enrique Landa. I'm recently a new community organizer for the East Trenton Collaborative. I've done a lot of outreach work for Newark when I was up at Rutgers Newark, and I thought there's so much good work being done over here. There's no reason I shouldn't be helping my hometown. It's especially personal as well because of the grant school, like lead contamination they found over there. I used to be an elementary student over there, so it hits very close to home, not only to Trenton, but the places that I got my education at. So it's very nice to be on this other side of the room. So that's me.
You want to pass it to someone?
And I'll pass it to a very hard worker over here that I met recently. I didn't know how involved that he was going to be in Trenton, and it's crazy how much work that he's done so far. I've only seen glimpses of it over here. Sean Stratton.
Thank you, Enrique. My name is Sean. I'm a PhD candidate at Rutgers University School of Public Health. I'm working with Sherelle and Enrique and the rest of the East Trenton Collaborative along with Lead-Free New Jersey to conduct lead testing throughout the state. Or mainly, my focus is mainly in Trenton, but Rutgers is getting involved in many more places. And yeah, I'll pass it to Heather.
Thank you.
Thank you, Sean. So yeah, Heather Sorky, Lead-Free New Jersey Program Manager. It's good to see everybody. Glad to be working with Sherelle. Super proud of all the work that she's doing here and alongside of our other Lead-Free New Jersey hubs. So I'll pass it over to Cassie.
Hello, I also have staff for Lead-Free New Jersey Collaborative. That's everyone in person. So how about Brianna?
Hi, everyone. Brianna Payton-Williams from Trenton Health Team. Good to see everyone. I'm the program manager for policy and advocacy. And I'll pass it to Kari.
Thank you, Brianna. Thank you. Good to see everyone. Kari Muhammad with Green and Healthy Homes Initiative. Technical assistance around lead poisoning prevention and healthy homes. Let's see. I see a person, Ray Ingram. I don't see them, but I see their name.
We can't hear you, Ray.
Do we want to circle back to Ray, see if we can hear him a bit? All right, well, Ray, if you can try to unmute yourself at any point. We can't hear you now, but I can go next. I'm Kurt Latuma. I'm a program coordinator with the East Trenton Collaborative. And Eric, I can turn it over to you.
The Finance and Operations Director for Urban Promise Trenton. I gotta pass. I'm sorry. The representative for Shirley Turner's office.
Good morning, everyone. My name is Deborah Lee Barksdale. I am with Senator Shirley K. Turner's office, and I serve as her manager of external affairs. I will pass along to Melanie.
Hello, everyone. I'm Melanie McKeever. I am a state policy advocate at ISLE. I do apologize. I'm driving in from Jersey City, and I'm actually on my way to be in person with you guys. So right now, I guess I can pass it to Alex Feldman.
You say
Did you go
no.
already?
Yeah.
Thank you.
Hi. Thank you. Yeah, good morning. Alex Fellman, Director of the Trenton Neighborhood Initiative at Trenton Health Team. And I was going to drive over to you, but I'm staying put. Sorry. So here I am. I'm here virtually. Just today's a little crazy. So sorry. And I'll join this way. And I think I joined a minute late, so I'm not sure who else hasn't gone yet.
I think we're gonna pass the IELTS team, right? And
Okay.
So that's part of the IELTS team also.
Good morning. We are Shadea, Cherie, and Jimmy from IELTS. We are the team that's responsible for scheduling and going out and conducting healthy home assessments in Mercer County.
And Elise Pivnik here, also part of the team, but far away today.
Hi, Ray.
Good morning.
Thank
Hi there. Hi, it's Kelly. I am interested in what y'all are doing, and I want to become educated so that I can advocate wherever I can.
Thank you. Thank you, Cal. Is that everyone?
That's it. Yeah.
Oh, I appreciate you all for being here. So just sit back, relax. We're about to see a short video. Do we have the lights?
I can do the lights for us.
Yes, I can. Thank you, Rita.
Big words. He was very bright. But when we found out about the lead is when things start to deteriorate. I noticed that sometime I would speak to him and he'd be looking at me like I'm crazy. I'd be like, you don't hear me, but I didn't know he was having seizures. They sent the CBC to my house and said that your son lead levels are very, very high. Then they just gave me a pamphlet and told me what he should eat, what he shouldn't eat. There was no support teams, no nothing. There was nothing there to help me get through it.
With the acute lead poisoning, you might see a child have really bad stomach pains. You may see convulsions, speech problems. But then there's the chronic low levels of lead toxins. And we see a lot of this. Those low levels are messing with our children's behavior. It's affecting their learning. And with these issues, they wind up leaving school, can't get good jobs, and the cycle just repeats itself. But if we get rid of lead, we can stop that cycle. We get it out of our water. All we need to do is change those lead service lines. We have high levels of lead in our soil. We cap that soil. We have a lot of children in these homes with chipping, peeling paint. If we could have our legislators and our landlords do the right thing, we can save our children. But it's going to take community voices to rise up and make government do what they have to do to remediate this issue once and for all.
My mission is to share my story and try to make things happen because there's a lot of kids out here that's sick and their parents don't even know they're sick.
Lead-Free New Jersey was created to bring all those voices together because we can't do this alone.
Wow.
When I cry,
Hello, everyone. So that was done with our Miss Keisha Smith, who has a child here in the East Trenton neighborhood. He's now, I believe, 16, and he gives his mother the run for the money. His behavior is so uncontrollable, and in school he feels like he can't do right, and he's like the last kid to understand what's going on in school, so he doesn't really want to go. So we have to get out those community voices to let others know the impact of lead toxins and what it's firsthand account of what it's doing to the children in the neighborhood. I'm just gonna say a couple of things. Before I say anything, does anyone have any comments or anything that they want to make during the video or of the video? I just want to start by letting you guys know how I got started with this whole project here with the lead, and the testing that's been going on. So I'm just going to start with, as an organizer, you get to, you learn about the community, a local organizer, you learn about the community around you, and you learn about the residents. As just a resident, I can go to work, come home, go in my house, and don't care about what's happening outside. But as an organizer and living in the community where I organize, you get to hear your community voices, and you get to love the things that they love. You feel the pain that they feel. You know what's happening. So back, I believe it was 2022, after I started getting in, the beginning of getting involved with lead-free New Jersey, I had a resident on Clegg Avenue call me screaming and crying. She's like, Sherelle, I hear gunshots over here. I hear somebody screaming. I think they're dead. And I'm like, oh my God, what do? I don't know what to do. Yeah, I didn't know what to do, but we're doing something now. Because of that, we had a meeting, Lead-Free New Jersey. We had a meeting, a Zoom meeting. On that Zoom meeting, we had EPA. We also had our beloved city of Trenton, our mayor, Rika Sierra, was on this meeting. And we talked about the crime that's happening in the East Trenton neighborhood and why there's so much of it. And because EPA was already in 2018, had done some soil samples in the neighborhood, and they knew that the lead levels in the soil in these neighborhoods was coming up really elevated. And these were the same neighborhoods where there was a lot of high crime. I myself wanted to make a connection. Oh, okay, there's got to be a correlation here between lead and the crime. As Sean would tell you, like, Sherelle, we cannot make a correlation, or we cannot.
It's just very difficult because there's lots of other
factors
and confounders.
It is difficult. But our mayor says, Sherelle, if you feel this way, maybe we should go and do some testing and really find out. And thank you, Mayor, for suggesting that, because it didn't stop there. Sean Stratton, academia, they found out what we're trying to do out here. So Rutgers is involved, and Rutgers came out, and we went and we sampled certain streets in the neighborhood for the soil, and it came back highly elevated. But we're not stopping there. We're going forward. We're going back in the home, and we're going to test some more. I just wanted to give a background that why we're here today, and how everything is coming together. And I also wanted the city of Trenton to give some remarks about, now that we know that the soil and is really toxic and has elevated lead. We do know this town is filled with a lot of poverty. We do know that racism still exists, poor housing, poor water infrastructure, and our children are out here going through it. And they don't even know why. They think it's their fault. We have to help. So I just want to give some updates on where we are now. Shauna give some updates later about the work and where it's gone. Community and academia working together, getting things done. He's going to give an update on that. But if we have anybody from the city of Trenton or the Department of Health that would like to give an update, possibly on the testing, was there anything else? Or the lead service line replacement? Because I do know City Hall Council did meet last week about the lead service line. And I think there's a $10 million that they all voted yes for a bond to start the lead service line replacement. So what's going on with an update with the lead in the soil, the lead service line replacement, and possibly are we doing anything with the testing with our children for lead?
Also the homes, right? And I know the Isles team is here, right, on the housing side, so maybe they can give us some perspective on what they're seeing. But I think Yandra unmuted. I don't know if you want to start there. And this is not technically till later, but since we're talking about the
Sherelle?
Yes.
I couldn't tell. I just wanted to, I'm sorry if Heather was, I couldn't tell if she was talking to the group or, anyway, really quick, excuse me if I did interrupt. I just wanted to comment on the testing at Grant School that I've been working with the Trenton Health Department to support them around education. And I've been there the last couple of weeks. I think they were on a break in between. So the first week I went, they had a pretty good turnout in terms of children being screened and receiving education, around lead poisoning, around lead in pregnancy. So, we were able to support the community around that. Unfortunately, I was out yesterday and I was happy to meet some other folks from Isles who were there as well, but we didn't get anyone in to screen. So I'm hoping that we can continue to do that work, but, maybe somehow market it better, not sure why we didn't get any children in. I don't know if it was because they're coming off a break and I don't know, people weren't aware, but yeah, we didn't get any children in. I think we got some adults that were screened, but no children.
So just a question on that, or I guess a comment. I mean, I didn't even know that was going on. So, I mean, Sherelle, did you know that was going on?
No. What was the testing being done at again, Kari?
They're screening. The Trenton Health Department is screening every Wednesday at Grant School. What was yesterday? Wednesday? Yeah, every Wednesday at Grant School.
Yeah. So
I think we need to get you on that mailing list
in terms of getting information to the students, to their parents, because clearly maybe that didn't happen. I don't know. And I can't speak for the Trenton Health Department. Again, I'm just there to provide supports, to them any way that I can.
I mean, I think that's an ongoing thing, right? Sherelle is like the outreach, and I know Elise, we've talked about this, is, if there's things we can share broadly as partners.
Sure. I think we need to get you on the list. Micah Freeman sends out the notices.
Okay.
And let's just call them and say, please put me on the I think it's every Monday at 2 p.m. It's been set, except for the vacation.
Wednesday. Kari said Wednesday, right, Kari?
I have a quick question.
From my understanding, it's every Wednesday. I'm going to say the Wednesday prior, they tried a different time and they thought maybe if they pushed the time up that they would get more students. So it's a trial and error thing. So yeah, I wish Trenton Health Department was here to kind of speak about it. I'm just not sure what happened with yesterday.
Beverly? Okay.
I have a quick question. Is the data being shared publicly on the kids they've so far screened?
No,
Okay.
they can't share that. Elise wanted to say something too.
No, I think I just, get on Micah's, Freeman's mailing list. She's the one that sends things out. And if the time changes and the like, it all comes from, it's generated by the school.
Right. And back to Beverly's question, Elise, they can't share that information, right? Obviously, because it's HIPAA protected. So
Right. There's nothing that will be, maybe they'll eventually share things in a summary fashion without, but we'll have to ask.
Right.
They can share at least how many children have been screened. I mean, again, they can't share that protected information.
See, I was hand.
Okay. Kari, you got frozen and Owl's hand is up.
We have attended the last, I think, all 3 of the events. Reach out to Micah today. If they have flyers that promote the event, Shadea, Jimmy, and I will go in the area around the school and distribute flyers door to door. And maybe we can get more people to come out that way.
I would be happy to distribute flyers here at the center as well.
Excellent. So as soon as I get in touch with Micah and find out what promotional materials they have, our first stop will be you.
Oh, thank you. I appreciate that. Alex has a hand up.
Do we know if these screening events are only for grant families or is it open to other folks? Kari's saying no, just grant.
Okay.
Just the grant students right now because of the elevated, soil levels. It's not open to the public.
Has there been any talk in these meetings about expanding the testing in Trenton to non-affected families? Because this I think has raised a lot of questions for families across Trenton because of the soil testing and knowing the levels are high. So has there been any more traction? I know for 2 years we've been trying to get the testing program to be more proactive, but has anything happened along that, Kari? Have you heard anything or Elise on steps that they're taking to be more robust in that effort?
I'm sorry, I didn't hear the last sentence.
I just asked if there was any more effort being made to make the testing program more robust or expanded, beyond the immediate need. And obviously, they're not getting the numbers for grant school, but, maybe if they did open them up, we could, expand to get more children.
Yeah, I have not heard that. We kind of were more on the, I just have not heard anything more. It's focused on grant school is my understanding.
And the reason I'm asking Elise, we just, for those that don't know, Lead-Free New Jersey has a bunch of committees, the Water Committee, which Deandra leads, and we have a Housing Committee, GHHI chairs, and Elise is one of the chairs for our newly formed Health Committee. So that's why I kind of keep pushing it back to her because these are, things that as the hubs bubble up, priorities, we want to make sure that those are getting to the advocacy and steering committee structure of Lead-Free with our partners to push on these requests, right, and needs of the hub. So I just want to make sure that we're flagging these things for later meetings and getting them into the notes, and that's why I'm asking. So just to be clear on that.
I just want to make a comment that it's great that Trenton Health Department has come into a grant school in their screening, and that we all recognize that that it's a process. Again, if you're not aware that something is happening, then you don't know. And I think that again, messaging is critical. That if Isles, I'm with Sherelle, if Isles needs some support and standing in front of the school and passing out flyers, then I'm willing to do that as well. But we also have to keep in mind that a lot of the parents are Spanish speaking, so we want to be able to accommodate them in that way and explain. But I think also what's important is that we know that Trenton the Trenton Health Department is working to support these families at Grant School. And I think that there are other, entities, other resources that we need to get involved, in this screening process and not just lay it at the feet of the health department, who not only is working with Grant School, but they also have an obligation to other Trenton communities and children that are screened. So we have to bring in our other partners to support this work around screening.
Yeah, that's why transparency, I think, collaboration, communication are really going to be critical to getting this expanded and getting it done.
Yes, Ryan. Thank you.
I did want to mention something because Ashrel and I were at Grant School not too long ago to kind of promote the testing. Even the teachers kind of feel like they're a little bit in the dark, and I find it interesting how there's a bunch of, I feel like, mobilization that it comes with like the lead remediation. And then on the flip side, there's so many parents and teachers that feel like there's so many fingers blaming, and there's just a bunch of like not misinformation, but lack of information. So I think it's important also to see what is the best method that we can use to really get that information out there. Because I feel like there's so many flyers and there's so much information, and it just gets lost in translation somehow.
Yeah.
Know that you're coming. So I'm like, so they have to call as a heads up. And now I'm hearing that there's a form.
Do the parents have to be present for the blood draw as well, or can they just sign the form?
From what I've heard, they have to be
present.
But this is the first time I'm hearing about a form.
So Kari says they do have, the parents need to be present.
What I've experienced is that they come in and they complete a form and then they go to the table with their parents and they're screened at that time. So all the kids I've seen are accompanied by parents.
Thank you, Karen. So we actually need someone from the health department here as well. I just want to say, I talked to Joel and John are with the US EPA, and they've been out here testing. And two of my residents came over to the hub, and it says, you know what, Sherelle, we seen a big sign on a resident's door that said the house is contaminated with lead and the family had to leave out. So I asked Joel and John, and I heard white hazmat suits were over here. So I asked the EPA, did you do that? And it was like, oh, we don't do things like that. The Department of Health will do something like that if they have discovered that a child has tested with elevated blood lead levels, then they come over to the home, and the family, I heard, had to leave. Hello. So that's just a question, and at least maybe you might be able to help me with. Do you know of when a family is tested, a child is found to have high elevated lead levels, and the DOH has to come in, and that family has to relocate? Are they taken care of? Will I have a problem getting more families to want to tell me, you know, or take a test because they're afraid of being put out of their home? I don't know.
You know, I don't know about that. And Cherie, you may have something to add here, but I'm surprised that they would put up something that would stigmatize a whole house, given how careful they are with information from, you know, lead screening information. Cherie, do you have any insight here?
It's been what we find in those situations. Once the notice of violation goes out, the homeowner has a certain amount of time to get the lead either remediated or abated. I've not heard of a family being asked to leave their home because of it.
Really?
Was there any phone number on the sign or anything like that?
So I got to find out what address. I went over there. I did hear that the sign is down, and I want to go. I hear that the family is back in. I'm not sure, but I do want to go and talk to them. But Enrique, you're gonna have to come with me because there is a language barrier, and I will find this information out. But yeah, I've had eyewitnesses come and tell me there was a sign on the door.
I know Elise, and I shared this with you, Cheryl. I know Elise, going back months now, like probably about a year, we had a family reach out from Phillipsburg, from Warren County. It was a mother. She had, I think, 4 lead-affected children, was pregnant herself, and also lead burdened. And the landlord had evicted them because of not wanting to deal with the lead in the apartment. And I know I had reached out panic stricken to Dan Norton and to Elise and to Stacy Berger of the network and said, you know, what do we do? Because we're not technical assistants at Lead Free New Jersey, but certainly want to help where we can. And I know that you all kind of rallied to contact the DCA, and DCA does have a program, as I understood it, to put families affected by lead into temporary housing. Is that statewide, or is that something that was specific to Warren County?
So my experience is that it used to be available. I'm not aware of how it works now. Cherie, maybe you know that.
When we had HUD funding for lead abatement, we did have money to relocate people temporarily, but that's only if it's a tenant and the landlord is unable to afford to relocate them.
Okay.
But we're finding a lot, unfortunately, with Latino families. Sometimes they're not comfortable filling out the paperwork for the application because the landlord owns the home, but you get qualified based on the tenant's information. And it's difficult to explain the process to people who speak English as well as I do, because it's not common terminology that you use. So then to try to translate it to someone who's found themselves in a situation where their child is poisoned because of the lead paint in the landlord's home, but now Cherie is using a translation app to ask them for all their personal information. It becomes very confusing when they don't own the property and the notice of violation is issued to the homeowner, not the tenant. So often tenants find themselves where they're in a situation where sometimes the landlord is not a good landlord anyway. They weren't keeping up on repairs, they weren't taking care of things. We have landlords that have multiple Spanish-speaking tenants and have no one in their office that speaks Spanish. As long as the person is paying their rent, that is all they're concerned with. And then the landlords look at it as a burden because the tenant's child is now lead poisoned. and we're offering the service for free, but then you have a scared family, scared because someone in the home may be undocumented, afraid because their child is lead poisoned, afraid because the landlord said you have to fill out this paperwork so we can get this taken care of. It's a messy situation. And we do the very best we can to explain to them that we're not there to hurt them, not there to report them. We were able to get DCA to change it where we don't even need a social security card. If they have a passport, if they have something like that, we can move forward with it. But lots of times we'll find that the family will opt to just leave rather than give all their information for a home that is not their own. And we try to make sure everybody understands. If you are a tenant in a home and we detect lead paint or your child is poisoned, we do need the tenant's information to qualify them for the program, but that's connected to the house. A tenant can move to a different apartment every year. And if they still qualify and there's lead paint, we can do it. They can change apartments 5 times, then buy a house. If there's lead paint in the house they purchased and they still qualify, we can still do the remediation. And there are a lot of programs that are like a one-shot deal for people. You apply for this program, you're only allowed to do it one time. That's not what it is with lead. So we make sure that we do the best we can to express that with families. And we've had a hard time finding Latinos to be part of the team and stay part of the team. So we're fortunate to have our head of maintenance, Roberta. He will make that first call for us and explain to them, okay, they're going to use an app, they're going to use Google Translate. They're not going to hurt you, they're here to help. We've done this with dozens of families, and that helps us kind of bridge the gap and make them feel somewhat more comfortable with us when we're interacting.
That's super helpful to understand that. I guess my question would be, does ISLES, because I didn't know all of that, and I think it's important information to have. Does that information exist? I know that we talk about fact sheets and how useless sometimes they are, but for those of us that need to work off of them, is that down somewhere or bulleted out, that we could utilize it? And I guess if it's not, is that a resource that we should look to create so we can have broader conversations about that?
The information is woven in and out and around a whole bunch of other stuff on the DCA website, but I will definitely go through it all and pull out what I think is relevant, or I can direct the whole team to it. I can send the link to Sherelle, and it would just be important that each part we extracted to make bullets from, that at the bottom we have some reference to the full verbiage that goes along with it so people can feel confident in that. And we make a point of referring people to the DCA website instead of our website when it comes to those technical situations and all the specific rules and guidelines. So people understand that if it was up to us and we had money, we wouldn't even ask for a pay stub, how many people live here, or anything. We just do it. We just want people to know that there's these rules and guidelines that we have to follow. But I will send that information to Sherelle so she can share it with the team. And in the meantime, we will go through and see what we can pull out from the information.
I think that would be, and I would love to put that on the Lead Free New Jersey resource page and social media, once we get that, because I think that information, just learning that today and hearing more about that has really helped me understand that. So thank you for that. I think that's huge.
Shereen, yes, thank you.
You're
Yeah,
very welcome.
We got to break down the barriers to our kids getting the help that they need. I mean, this how we handle COVID-19. We're still helping people out and giving out test kits and doing testing. We should treat this the same way, no different than COVID-19, and break down any barriers that we can so our kids can get the help that they need. So 10 years from now, we don't have kids, being exposed to this toxin.
I have a final question. I don't want to let ISLES team off the hook.
And then we got it.
I know, we got one.
Yes, sorry.
I can't get away. I just wanted to ask, in terms of the lead, the lead paint certificate law, which we're talking about, but Where is Trenton with that? Has the notices gone out to landlords yet in Trenton? Like, where does that stand at this point? Does anyone really know?
I'm not really sure about Trenton, but I know those notices has gone out in Lawrence and Hamilton and in Ewing. We're having landlords call us on a regular basis. And what we're able to do is work with the landlord to schedule an initial healthy home assessment and lead testing for their tenants. We don't need to have any income information for that. We'll do an initial test for anyone in Mercer County. And what that does, if a landlord is going to pay $600 for the lead safe certificate to have somebody come out and test, and there is lead paint, then they're going to have to circle back and get the paint remediated and then have somebody come out again. By us going first, if we detect the lead paint, if their tenant qualifies, we can do the remediation and then help them get the lead safe cert at the end. So, and those three, and Princeton has them out as well. I am not sure about Trenton, but I can find out about that. So some landlords are really taking it seriously. We have some landlords that call, they have like a dozen properties or more, and we're scheduling for all their tenants.
That would be great, because I know that was something we wanted to ask the mayor, had he been able to be here today, was, what is the plan for
the lead service line?
Well, to talk about the lead service line replacement, but also on the lead paint certificate side, because that's been out for a while now, and we haven't seen a lot of, you guys are doing amazing work, right? You guys are out doing your part, your thing. And I know GHHI is also working on that too, but it's the broader outreach. We get occasionally calls from landlords like, oh, I heard about this. What do I do? And we immediately on the card, we refer them to Isles Trenton, because that's the contact, right? So we do send them that way, but just if you have any updates at any point, even in between meetings, that would be super helpful. Sherelle, for us to know, so we can get the correct information out.
Yeah, because July 24th, I believe this goes into effect. And these residents need some rental units, and the residents in these rental units need to know that this law is in effect, and these landlords need to be checking their apartments, their units for lead.
Has anyone been in touch with the city recently, or is anyone regularly talking to Yolanda and the inspections team?
The work we do with the inspections office at City Hall is more in line with notices of violation for abatement. When there's alleged child, they've had a lot of turnover in that office recently, but I will reach out to Marat and see if she knows that notices have gone out for it.
Okay.
I wanted to ask a quick question, Cherie, or really anyone, but since Cherie, you were mentioning it, are the municipalities in Trenton, are the municipality responsible for the lead certification law? Who does that fall on?
It's a state law, but each municipality has their own guidelines and ways of monitoring and making sure the law moves forward like it's supposed to. Yeah. We're really not sure how they're doing it, but for Mercer County, what do we have, the 13 municipalities? They're not even the same. Some are visual inspection, and then some are dust wipe. So they're trying to get it together, but with each municipality doing it on their own, it's going to be at a different pace based on staff availability. So
you guys aren't doing any sort of collaboration with municipalities on this work?
We are doing collaboration. We reached out to all of them. And we're collaborating with the municipalities that have responded to our outreach. And the municipalities that have not, when we have people call in for other things, because we're fortunate to have a weatherization program as well. So when people call in for weatherization or emergency heating, you call us for one thing, you get everything. So we're trying to make sure we get out there and let people know if we conduct an assessment at one home, when we finish that assessment, we go and flyer a whole block. So we're trying to get the word out there and make sure that people know, especially if we find lead, because if the homes were built relatively the same time and we found it here, it's likely to be other places. So we'll work with whomever comes our way. We'll make it happen.
Excellent, excellent.
Thank you. I just want to introduce and I'm sorry, Lisa. Did you?
I just wanted to add, indeed, we will work with anyone. I know, Peter, we have been in touch with the city administration, and there's only so much you can do. Our job is to make the houses safe, to do the assessments, et cetera. It's not to do the job of the city. And we are doing our best to do our work and remind them of the things they need to have done.
Yes. Thank you, Lisa.
Right.
Mhm.
And who is that?
What's her name, Ray? You know? Okay, we'll find out. Thank you, Ray.
Let's go.
Thank you. We'll find out. So thank you all for being here. We're going to discuss a little bit. Oh, before we have another guest and she's going to introduce herself. So please.
My name is Melanie. I was the one on the drive. And I'm the state policy advocate at ISLES. I work with Ben and Elise and the ISLES team that's up there. I do mainly like trying to push bills that align with ISLES' mission. And I do help out a little bit with policy when it comes to the lead work and stuff like that. But pretty much I do wherever they need me to do within the organization.
Get it in where you fit in. Thank you. Yes. Thank you for being here. And because of Alex, we are holding this meeting now. And today you're like, Sherelle, when is the next select coordination meeting? I'll get it done, Alex.
All right. Thank you. Thank you for bringing us together again.
Thank you. And I know you want to talk about the SDOH, the social determinants of health. But before we go into that, I'm going to talk a little bit about this hub and the hub's vision and our plan and how we all align to this plan.
I was just wondering if the agenda was in the chat.
Oh, was it? No. Oh, thank you, Mike Cassie. Okay. So you guys can get to see too. We're not going to go over everything, but then it's a vision about what our community can do, a vision about what our city can do, and a vision for what some of the things our state can do, and I guess other organizations as well. So you see yourself fitting into this vision and knowing how to help get us there, please. That's how we're gonna not just talk about it, but we're gonna be about it and we're gonna make things happen. So Cassie is gonna help bring this vision up. Thank you, Sheila Cartwell, for making it on. I seen your name up there. Yes. Do you want to introduce yourself as well, please? Sheila?
I'm at work. I'm gonna just pop on for a minute. I'm a school nurse in Matawan Aberdeen District in Monmouth County, and just was made a chair of the health committee for the Lead-Free New Jersey, but do a number of things related to school health, mainly being a school nurse, and intervening when it comes to various things things that I might have a passion for, including obviously this whole lead situation. which, so systemically based, and we're just kind of stuck in it. So trying to put out the fires, but we do obviously need to, as you mentioned yesterday in our presentation to school nurses, get to the root of it and solve the root issues. So just a quick intro, but I have kids coming in and out of the office, so I'm going to be just listening in. So for now.
Thank you, Sheila. So Cassie put in the vision for our Trenton Hub. Please jump in, anyone, where you want to. But I'm just gonna go over, you can look over the vision, give me any ideas that you may have. I'm just gonna pop out a few of the items that I think needs to really be focused on, and so will Enrique. He will come with any things, and if anybody see anything on this list that I did not mention, please just. So our community hub, we have certain visions that we put in place what overall short and medium term success looks like. These high level success outcomes inform our awareness and education work and advocacy priorities. So for our community members and partners, some of the things that I've identified that should stick out to us to do, and make sure that everyone has one of these. Can you please, Enrique, since he has one. Yeah. Community members and influencers understand the risks associated with lead exposure. So we need people that's out there that's talking to people every day, that other people are listening to know the risks that our children are going through associated with the exposure. I think that's very important, and for our partners too.
Because add to that in languages that they understand. Right?
Okay. Yes. Yeah, because we have a lot of people still don't know in 2024, lead is still a problem, an issue. So there's another thing that community really need to take action. Oh, forgive me. So community members take action to get children less than 6 years old blood lead level tested. So right now we have EPA saying there's lead at Grant School. We have DOH out there testing, but the community isn't really coming out there. So there's a barrier somewhere. We need to break down that barrier and get this community to get together, make sure they get over there and find out if they've been exposed to this toxin. So we need to make sure that we are getting community members to take action. Another thing that I've outlined in this vision is community members advocate for improved, accelerated lead remediation inside and outside their homes. This doesn't take a rocket scientist to know that even if our children do get the help that they need, we're sending them back into our home that's making them sick in the first place. I mean, we need to do whatever we can do as a community, as partners, to advocate for improved homes, improved housing, and the remediation. EPA is out here. Hopefully they're getting this lead out of the soil. We got to advocate for everybody and anybody, DCA, to do something with these old pre-1978 homes that are still carrying chip and peeling paint, and our children are being exposed. And you don't see the symptoms because it's the chronic low levels till 10 years later, and you don't connect it to the lead. So those are just some of the things I wanted to highlight in the community before I pass it on to Enrique. And he's gonna talk about some of the things the city could possibly do in this vision. And if anybody wants to add anything before I pass it to Enrique, please do. Enrique, you know anything that the city can do?
Yeah, just to reiterate what Sherelle said earlier, I'm not going to be going through all of the bullet points listed in the city, but I do want to highlight things that I don't want to call them struggle points, but something we could definitely bolster our efforts in. So to start off with, more visible, transparent, and being engaged with the community.
Yes.
We know there are socioeconomic problems that need to be addressed. We know that there's language barriers, and we know that lead isn't exactly immediately noticeable in the children. So I think the city and maybe, more partners can really help with understanding how to get this message across in an accessible way, in a digestible way. And not only that, but understand what the next steps that these parents and residents have to take
Yes.
after they find out, because it's great to know that it's there, but
What are we gonna do?
what after that?
And their rights, right?
And their rights. Which leads on to the other one, proactive in enforcing laws that ensure the safety of residents living in pre-1978 lead hazardous housing conditions. So of course we were talking about the paint certification law and the lead service line replacement. There are a lot of laws getting into place to remediate these houses, but the enforcement needs to be there. That kind of I don't want to call it pressure either, but we have to be a little bit more assertive with these laws that are being put into place, because we know they're being passed, but again, next step after that, what happens? Again, leading us to the other bullet point, the city enforces housing laws and holds landlords accountable for lead hazards with hefty fines or option for residents to repair with partners' helps, and option for tenants to legally own.
Yeah. I needed to say something on that.
By all means.
I see a lot of residents, and they live in these homes, and they're like, well, Sherelle, should I do the work? Should I not do the work? Yeah, I mean, if your home is falling apart, you live there, do what you can. And if the landlord is supposed to do it, is fix it, make a receipt. And I think if this happens over and over again, and the residents are doing these repairs to their own homes and they have the receipts, I mean, maybe they can get an option to own this property. Obviously, the landlord doesn't care. And I think our city needs to be more proactive in enforcing the laws on these landlords. They let them get away with certain things they should not. They're hurting our community. But most importantly, don't forget, we do this for our children. Our children are our future. Our children matter. I'm sorry.
Can I just add to that as well? I lived in an apartment, unfortunately, that had mold, black mold, to the point where it has affected my fiance's health. My health, my children, we were all fine, but this was 4 years ago, and he still cannot eat anything.
Oh my God.
That's how bad it had gotten. He went from about 200 pounds to maybe 180 something, but drastic change. And like you said, I ended up having to hold my rent. Now, what was worse was that the landlord was a family member who also worked for the city. And so I had to call the city, and because of embarrassment, because I had to call his job and tell them what kind of a landlord he was, is what got him to start making, the repairs. But in that, my fiance knows how to do work in houses and stuff. So things that we paid for to fix, we, like you said, made the receipt, but we also had to hold the rent. And I made copies of my, rent receipts and stuff like that. And I said, listen, I have the rent. Here's a copy of the money order, but you will not receive this until you start making, and that's the legal way. So the residents also need to know that there are ways that they can force the landlord's hand to do what they have to do, because even if they decided to go to the courts and gave them a rent receipt to the courts and said, okay, here's my rent, and they hold it. So now, if you didn't trust me, or you didn't, feel that the photocopy of the rent receipt, the rent was sufficient enough, hey, let's take it to court. I'll give it to the court, and the courts will give it to you once you prove that you have fixed what needs to be fixed, whether it's the lead, the mold, or whatever it is.
Yes.
Because the apartment was pretty bad. So I ended up having to move. But
then they're gonna move somebody else in without these things being.
well, they
fixed.
couldn't. I didn't move out until they finished the repairs anyway.
Okay.
But they couldn't because now he was being fined, and it's in the system now. So the city was coming out and checking it every week, or depending on what the job was, because when I tell you he had to redo the whole bathroom, it got so bad that when they went to do the bathroom, they went to take out the tub, it fell.
Oh my God.
That's how bad it was. And I said, it could have been 2 more showers. My kids could have been in there taking a shower and they could have fallen. Like
it was rotted out.
Yeah, it was that bad.
I'm so sorry.
So it wasn't something that they could just sweep under the rug. Like it was that bad that the city, like he got hit with a lot of fines. And he would not have been able to move anyone in there until that work was done anyway. So
wow.
But yeah.
Thank you for sharing that.
So, I mean, if residents aren't aware that they can, like, you can't play with the money. Don't take your rent money and go shopping with
Exactly.
it. But purchase the money order, make it out as if you're going to pay them, and then, make the photocopy and say, here's the rent. I have it, but I'm not going to give you the rent until you make these repairs.
Yes.
And then also to the lead testing. I was speaking with McKnight last session on 1507.
1507?
The
Entrance to school.
Yeah, the entry to school for the lead testing or whatever. So there was technical wording in there that
they didn't do it, right.
So, but she was, we were talking and she was like, we do all these back to school book bag drives, and why aren't we partnering with, the
like WIC, Women, Infant, and Children,
or not even them necessarily, but what are they called? The
Trenton Health Team, the Henry J. Austin.
No, when you don't want to go to the hospital, but you could go to
urgent care.
Why aren't we partnering with the urgent cares? And during these festivals or whatever they are, these back to school book bag drives, have them out there, do the testing there. We could do that. Like if they were able to bring out tables and do testing at school sites, or, they had these mobile testing centers when we had COVID. Why can't we have one similar, but do the lead testing and have them come out and do those testings while they're coming out to get their book bags? And I thought that was a really good idea. So I'm gonna see if I can work with her on doing that, because I'm from Jersey City. I'm not from Trenton, but that is the plan. But there's no reason why every town or every city in New Jersey.
This is the state of Jersey. We're all trying to do this together.
Same thing.
Yeah.
So if during, I know it's a couple months away, but it's time to prepare, and it might be the best time to really get this information to the parents of how important it is.
Yes.
And while they're there, say, hey, you're here already, just sign this paper and let me take, you know what I'm saying?
And I know we have Beverly on too, right, from Senator Turner's office, and she, I know Senator Turner, this has been a big undertaking, but very important to her as well. So, I think, maybe statewide initiatives or campaigns, promotions, things like that, is something really a larger message, right? A larger scale. I think that's I'm glad to hear you working. Thank you.
Thank you.
Thank you.
Yes.
Do you see that Isles has their hand up?
Oh, no, you know what?
Thank you, Kurt.
Yeah.
Yes, Al.
I agree 100% about moving forward, being more vocal. It's so difficult for tenants because they don't know what their rights are, and landlords know they don't know what their rights are. And we're in a situation right now with undocumented families, not just Latino, African families, and a lot of families that landlords really feel like they can do whatever they want to do and not do what they should. So we do need their voices. As far as organizing, Sherelle had an event a few Saturdays ago. And I took my shower, I got dressed, and I got, it was pouring down rain. It was buckets all day, and I really thought I was going to go to this event to just talk to the other vendors. But people came out. I think what we could do, I know we can't clone Sherelle, but if we could get to a point where people realize, the people who are organizing events, understand that it's not just about spending their money and getting their message out. You have to do it in a way that makes people want to come where you are. And Sherelle had a good setup where, okay, maybe people weren't concerned about lead paint. They don't know what it is. They don't know if it affects you, but there was food. There was food ready to eat. There was food that you could take home with you. There were other services you could get instead of people coming someplace expecting to get 15 flyers about 15 different programs. And yeah, our flyer is English on one side and Spanish on the other. How many people read Spanish? Do we have it in a dialect they understand? So I think we need to make a true effort to partner with other Latino agencies to make sure that they're present at the event we have. Because I think their presence will make people feel more comfortable with interacting with those of us that are using Google Translate or an app. I don't know how many Latino churches there are in the area, but I know if my pastor tells me to do something, I'm likely to do it. So I just think we need to get out there, Haitian churches, African churches, whatever we need to do to get the message out there and make people understand, let them know, undocumented or not, you have a lease. It's a contract for you and for the landlord. The landlord has responsibilities, you have responsibilities. And when in those situations, like forget being undocumented or not, if you don't have a good credit rating and you're in an apartment, your landlord can treat you any kind of way because you can't just get up and move. You might not have money for another security deposit. So it's a lot of reasons that people will tolerate being poorly treated. So I think, as everybody is saying, I agree wholeheartedly. And whatever it is we can do here at IELTS to help. Jimmy and Shadea have not been here 2 weeks yet, and they're probably thinking, what did I sign up for?
I didn't get it last far.
See, they've been there 2 weeks and they're like, what did we sign up for?
No, Jimmy and Shadea are great. They were great in the interview and they've been great the time that they've been here. And they both have a heart for people and are digging in and learning everything they need to learn to get out there and not look just for lead paint, but for other health and safety issues.
Yes.
We can educate people and refer them to programs that can provide things that we cannot.
What's that, Shereen?
Well, can I add something? I'm sorry. I didn't put my hand up.
No, it's okay, Karen.
I just wanted to add, that I understand it's important that we educate, tenants about their rights, but we have to be extremely careful when we talk about making their own repairs when a landlord hasn't, because again, you dealing with lead, you can quickly contaminate your environment and poison your own children. And just to keep in mind, it takes like a sugar packet of in terms of lead dust concentrations to poison your child. So it's great to tell them to advocate for themselves, but at the same time, we want to be extremely careful, about the message we send.
Well said. Thank you.
I agree.
Yes. Before we continue, and it's 12:13, we're here till 1. We've got a lot to cover. We all introduced ourselves. I need Joe to introduce himself and just say hello and who you are, Joe.
Sure. Can you hear me?
Yes.
Hello, I'm Joel Petty. I'm the project manager for the Environmental Protection Agency. That's my dog Penny that you hear behind me whenever I say hello.
Hi, Penny.
Trying to turn my camera on here. So yeah, so whenever whenever you're ready, I can give you an update on the EPA status for the the elevated levels of lead we found in the soils. But whenever you want me to do that, I know you were in the middle of.
Thank you for being here, Joe. I'm just
Of course.
here. We're gonna go a little bit about the healthcare community, and what the healthcare community can do. So I mean, everybody has the healthcare community has expanded blood level testing to ensure easy access for community members, including pediatricians who actively follow up to ensure testing is completed. Anybody else wants to read any of the visions?
I guess I'd ask Alex. Alex, is there anything standing out for you in this section?
For the healthcare community?
Or healthcare providers, excuse me, to do this work?
Yeah, I'm here. Sorry. Yeah, I mean, I think this is a clear vision, but I guess I'm anxious to get to the conversation about action. Like, what is it that we're going to do together to get to this vision? And I have limited, insight into what we'll do with the healthcare community specifically to take action. Of course, we can share our thoughts on that, but I don't want to jump the gun though here. I mean, if you want to keep going through the vision and then.
I mean, I think it's relevant, right? I mean, we talked about other things along the way. Are there things that stand out to you that you think are more attainable goal-wise on the vision list than others that that pop out, like in terms of priorities or feasibility?
I got one thing that when it comes to the health team, the Trenton health team, you guys are so data. You have the data. Alex, if I can use the data that you guys have on Trenton to help, disseminate the information of all the environmental burdens that's happening out here. Families think it's just happening to them. No. If we can share, if I can get your data and we could,
depending on what kind of data.
But we don't have the data though. I mean, that's sort of our problem, right? Is like we have yes, the Trenton Health Team has access to a significant amount of patient data from our full catchment area, which is across Mercer County. Most of the people most of the individual patients that we have that we have access to their data are Medicaid patients. So that's already a sort of narrower population that we're talking about. And within the data that we have access to, we do know something about the lead. We know there's a little bit of lead data in there. There's a little bit of asthma data in there, but there's not enough. And that has been our push for getting access to the lead data that's in CDRSS. So if we could, take that information and, we work in HIPAA compliant environments all the time. We are qualified to handle this data. We could use it to do that more robust analysis of where are their hotspots? Where are the buildings that have that chronic lead issues, and family after family who's renting in that property is coming out with an elevated blood lead level. If we could have access to that stuff that's in CDRSS, then we could do that sort of analysis and feed it to the city so that they could go in and inspect those properties. We could feed it to primary care providers to ensure that they are testing those families and say hey, you've got some patients who live in this area. We know that there are issues with these buildings. Or with buildings that are all owned by the same landlord. We could do that sort of analysis, but we can't because we don't have access to that data. So I want to do that. And if you all are saying that would also be valuable to share information back to the community also and say like, listen, like you're not alone. This is where these problems are. If you live in one of these areas, here's another reason why you should be asking questions of your primary care provider and of your landlord. Certainly we should talk about like how to make that sort of information useful from an organizing perspective. But I just can't do it until I have the data. And I'm not really sure, like we sort of hit a dead end at trying to get access to it. And I'm not really sure where to go. So if anybody has any insight into like who I need to restart conversations with.
I see Kari's hand, but before I go there, I just want to say, I know that this was a conversation too that we were having at the health committee, recent health committee meeting with Sheila. And I don't know that she can unmute because I know she's got students, but I know that this is something that we're talking about, right, alongside of the larger goals, and that's gotten bubbled up, right, within lead-free New Jersey. So I think that sounds right, to push for more transparency in regard to information and of course mapping, right, overlaying mapping on, what are the areas that have the lead in soil and the lead in paint and the lead in water, and like where do we focus because there's so much of it. So I would say too that this is at the hub level, just knowing too that it's also on the health committee, right, level, which of course, Alex, I'm counting on you to be a huge part of as well. So I think that's right. Kari, I know you have your hand up.
Yeah, thanks. Just to, I guess, piggyback off of what Heather was saying, Alex, so my question to you is, if you house data and the data is around Medicaid patients, we have ages of those patients, we have zip codes of those patients, potentially, possibly, maybe where they go to school. We can find out, what pediatricians or healthcare facilities are within that zip code. And like Heather was saying, you can always draw a map and draw a correlation around children being tested, specifically because we know Medicaid patients are supposed to be tested at least at 1 and 2. So that, I just want to say to you that it sounds to me like the data that you have is significant and it's something that we can start with.
Mm-hmm. Yeah. We have a draft of a white paper that never got anywhere that I recently was like, what are we doing with this? Let me see if I can bring that out because that goes into some of that. We looked at specifically in the HIE, the Health Information Exchange that THT administers. We looked at lead and we looked at asthma. And there's a lot of really interesting information in there. Let me try and get that restarted. And let's use that as a starting point. And whoever put that in the chat about Morgan Patrick, thank you.
Yeah, that's Cassie. Yeah, I think too, like that would be something too, Alex, if you're interested as you go through that white paper, just sharing it with the health committee too, that you're a part of, for lead free, just to further discuss it in between meetings if you find that helpful. That I'm sure will be of a lot of interest. I see Isles has their hand up too, Cheryl.
Okay, go ahead, Alice.
I just wanted to say that Micah just responded to my text message. She said the screenings they're doing at Grant School are for all Trenton students and their adults. And I took that to mean whomever their caretakers are.
Oh, wow. Okay. Well, let's get flyers together and let's get it out.
Yeah.
Oh.
Enrique? No.
I got you.
Thank you for doing that. That's huge.
You are very welcome.
Thanks for helping to get us on that list because our social media will be all abuzz later. I think about that.
Sheree, can she say that again? There was an echo on my end. I couldn't really hear. Could you say who it's eligible for the testing, please?
Like I said, it's open to Trenton students and their adults.
And adults?
And the adult that's accompanying the student. I think they didn't want to say parents because it might be a guardian and not necessarily.
Yeah. Okay. Thank you.
And what is the process? The process for registering would be, there's a form or you have to call, you know what the process is for that?
The first time we were there, people came in and they filled out the form after they arrived. So I'm not sure if there's something else, but I'm gonna ask Micah to make sure that she adds Sherelle to her list, and I know that Sherelle will make sure that everybody at this meeting gets whatever information that she receives from Micah.
Sounds good. All right. Awesome.
That's amazing. Thank you.
This is amazing.
So you have one
We're
meeting
moving.
for 2 hours, and you accomplish more.
Yeah, because look at the powerhouses we have in this meeting. I mean, Isles and Trenton Health Team, Kari, Muhammad, Joe, Petty. Oh my God. The children need us. We're gonna get this done.
Cool.
So it's already 12:24 and I want other people to speak, but you guys have the vision. These are some of the things the community, the healthcare community can do. Our state, let's see. I just want to mention one thing about the state, and then we're going to move on to Alex, and to Deandra, and to Joe, and to Sean. The state, the departments, they're not talking to each other. So, I mean, this is a vision that different state departments work together to ensure that children who have been poisoned, which is a strong word, I'm sorry, receive support and services and let safe housing options. But there was something where working with state departments, is that the one? Working with state departments to coordinate messaging, testing preference, processes, billing, and follow-up. A state of New Jersey needs to be working to coordinate all of this. And if anybody thinks of anything else that's not in our vision, that needs to be in our vision, let's put that together. Oh, here it is, sorry. Coordinate state efforts across agencies, an executive order for the governor to appoint an official to handle and resolve all lead-related issues across state agencies, Department of Education, Department of Community Affairs, Department of Health. I don't know who DCF. Oh, that's Department of Community, Children's, I believe, DIFAS.
Formerly DIFAS.
Formerly DIFAS.
And then the Public Porter Utilities.
Yeah.
If they can all be talking, everyone knowing the same thing, because this person can't get the information on this person, it shouldn't be this way. And we can all work together to help.
Well, we've
Go ahead.
started this, right? We just had Enrique, Sherelle, the other hub leads, all just had a meeting with the EPA, asked them to attend, just the hubs and backbone staff for EPA Region 2, Sabina Beck, to hear more about your visions, right? And then on the other side, we're continuing to have meetings with EPA Region 2 about blood level testing barriers and getting community voices and those most affected by the problem, making sure those voices are elevated in the solution. But we've also had the meetings with Department of Health Commissioner, with DCA, and where we left off last was the DOH Commissioner had told us that she was going to meet with the DCA Commissioner to talk about braiding funding and about braiding ways that they can work more cohesively around blood level testing. We need to circle back, and our health committee chair, Sheila, and Elise will be working with our advocacy committee to reach back out, find out, did that meeting happen? Where are we? And to pull us all back together. So those that were on those calls, anticipate that we're following up on that, because that is so important. Making sure that those state level states are working, state departments are working together, but that the community voices are being heard in those meetings, which we've been able to have some measure of success in doing and bringing to the first way. So I think the rest of your updates are all pretty much state level. Sherelle, which segues uniquely into
Deandra.
Deandra, Joel, and Sean.
So we have some updates, what's going on with the lead and water. We have some updates, what's going on with the lead and soil. And for the lead and water, I'm gonna pass everything over to Deandra.
Everybody, I'm Deandra. I think I met most people, but I work for New Jersey Future, and we coordinate the lead and drinking water work for the Lead Free New Jersey Collaborative. So I'll start federally. As you all know, Trenton is a part of the EPA Accelerators program. They also have some DEP oversight. So that means a lot of attention and navigating and coordination. So in terms of the lead service line program, Trenton they just finished their RFP process for phase 3 of the program. So if you all know, they stopped at phase 2, stopped replacements at phase 2. They just finished our RFP process in March for phase 3, which is 3 years. I put the lengthy request for the proposal in the chat so you guys can see what they're asking for contractors to do for that process. So they closed it in March 8th. Don't know if they've selected a contractor yet, but they'll probably say something, and that's supposed to go on for 2 years. And then last week they passed an ordinance for a $10 million bond for phase 4 of the project. So they stopped at 2. They're contracting now for phase 3, and they've added some money to for phase 4. I have to do a little bit of digging to see if phase 2 is just assessment, whether that requires actual physical replacements. However, if you look at the RFP, it says that these contractors will now have to work with the EPA program and NJDEP. So for the last couple months, they've done some analysis, and now they're getting a contractor to come in and do some work around that. So that's federal, local updates for Trenton. And then at the state level, I had a couple meetings this past month with Assemblywoman Reynolds Jackson, Assemblyman Scher, and also met with Senator Greenstein. They are the champions on all our lead and drinking water bills. So just a little bit of background. We have 2 bills that we're working on now. They are 82929, and the Senate version is S1034. That bill is a disclosure bill for tenants. So currently, as a homeowner, you get notification if there's a lead line on the property. If you rent where you don't pay your water bill, you'll never get that communication unless it's posted on the door, or sometimes water system will send a letter that says to the resident of the property, and then anyone can open that. But unless it's in that, you don't know. So the bill that we're working on tells the resident, tells the landlord to turn over all that information, including a little bit more. Tells about education on lead. It also tells the landlord to let the resident know when the property was built. So if you don't know when you have a lead service line, you also know if there's a lead level exceedance or how old the building is, so you can take some initiative of your own to get a filter or just get your child tested or so, because water systems are still figuring out where the lead lines are. But if your property's old, chances are you probably have one. So we're pushing for that bill to make sure that residents and tenants have that information. Second bill we're pushing for is A2938. Senate version is S1050, sorry, and that's a bill that requires filters for childcare facilities. This bill is something that we've been pushing maybe for 3 or 4 years now, and this is requiring filters for childcare facilities that are in rental properties. However, just so everyone knows, there's a national push for a filter first model. So not just in childcare facilities, filters everywhere, because there's probably lead anyway. But this is something that we started 3 years earlier before this push, and we're still pushing it as a gateway. But I know we're still thinking about what filter first would look like for the state of New Jersey as well. And then the last thing I'll say is NJDP has said that they will release their lead and copper rule April, May. We are now in April, and we'll see what happens next month. But we've been waiting for this rule for about 4 years, or 3. Yeah, 4 years, 3 or 4 years. So they said they're going to release it soon. So we're waiting on that. And then right now, DEP released something that they call a water supply plan. And that just talks about all water waste, drinking, and lead. So right now they've added some stuff about lead in there, and I'm submitting some comments on how they can enforce the lead and copper rule, the lead service line law a little bit more. They don't really have enforcement in it. They just say, be done in 10 years and 15 if you need more time. We don't want any more time, and we really want some real enforcement to get it done. So there's comments on that. And then just as an FYI, Department of Children and Families are doing their a round of testing of lead in drinking water in childcare facilities. And then this year into next year, schools are also doing their 5-year testing cycle. And so I'm setting up a meeting with DEP to talk about how they're managing that data. We did hear from DEP that they are combining the DCF and DOE lead in drinking water database, but they're just helping them out. So my goal is to find out if we need to pursue legislation to get them some funding. And then a long-term request of the Water Policy Committee was to incorporate both school data and childcare facilities data into something, into a database that DEP has called the Drinking Water Watch. That already has the database from like the residential data, but doesn't show schools or childcare facilities. So it's prime time since facilities are testing and the schools are doing their 5-year testing, maybe a catalyst to have them combine and have more data transparency there. I think that's all my updates.
Is that all?
I mean, the rest of it is, yeah, nope.
Thank you, Yatra.
You're amazing.
We should have been taping this. We have Joe, Alex, and Sean. Does anyone have anything they want to say before we continue? Thank you, Deandra. Joe, would you like to give us an update on what's happening with lead and soil?
Stolen petty.
Sure. Yep. I'm just going to try to share my screen here. Oh, screen sharing is disabled. Am I able to share a couple of slides?
You should be good now.
Okay.
Okay, great. Okay, so hopefully the screen is coming up for everybody. So I just want to briefly go through some of the, ongoing sampling and now actual action that EPA is taking based upon the elevated lead levels we found in the soils throughout East Trenton. So I'm going to start with Grant Intermediate School. In January, we received results that had elevated lead levels on the school itself. So that, was considered immediately a priority for EPA because there is such a high number of children that would have been accessing those soils daily. So that became the number one priority. So it has been determined what we call interim removal actions. So these interim actions are temporary covers of the soil that are considered protective. They are not considered a permanent remediation. The site is, we have our 2 programs, which I know I've kind of talked about before, and I know it gets really confusing and complicated very quickly, but the basics, we have our removal program who are currently doing work on the site. We have our remedial program that do these more long-term larger type of sites, which, the area in East Trenton that we know has lead contamination would be considered a larger, more complex site that the remedial program would traditionally handle. So the remedial program is evaluating all the data that's been collected to determine if it's eligible for inclusion on our national priorities list. So that determination has yet to be made. But in the meantime, our removal program is moving forward with actions on properties to, immediately be able to protect the public. So that brings us to the Grant Intermediate School. It was determined that there would be, depending on the use of the area, there would be 3 different ways that these soil covers would be addressed. And they include soil and sod, mulch, and artificial turf. And I know in the last call we had, there were some concerns with the use of artificial turf, but we do work with the vendors and make sure that everything is properly certified. And then with the soil and sod and mulch and anything that we're bringing in, sampling is done of that to ensure that it doesn't have elevated levels of lead or any other contaminants that we wouldn't want to be bringing into the school. So the cover installations are expected to be occurring later this month and into May. And as you can see, the field in the back of the school, that's where the turf will be used. And it's going to be used up to where the tree cover starts. And then you can't use turf directly under trees. So we would move to like a fenced off area toward the back. And that's where there would be mulch put in there. The soil and sod covers would be used for the rest of the back of the school that the students access. That would be like locations 13 and 14, and also 12 here as well. Most of the front of the school actually was very proactive when they found out about these lead levels. They did close off areas, and they also installed some fencing in these areas. So areas that are either fenced off and are considered like a very low use area, that's where mulch would be used. So that pretty much covers the Grant Intermediate. For the residential properties, this is just a very general results summary. So from the most recent sampling we did in the fall and winter of this past year, and additionally, the sampling we had done back in 2018 and 2019, we've sampled 131 residential properties so far. We collect soil samples down to 24 inches. And then we look for property use and residential information. We record that to determine what the exposure risk of that property is. So we did find elevated concentrations detected at all of the properties that we've sampled in East Trenton. Our removal management level for lead our policy was recently updated back in January. So that number, it used to be 400 parts per million. It has been lowered to 200 parts per million. And that is based upon the percentage of children 0 through 6 that would be anticipated to have an elevated blood lead level based upon exposure to that soil. So we've got a very good kind of sampling range throughout East Trenton here. So we've really, in this last event, we have really made that determination that the lead levels, the elevated lead levels do exist throughout all of East Trenton. So these are the proposed actions that are being considered for the residential properties. So it's the properties, the actions are chosen based upon the use of the property and if there's a vulnerable population present, which we would consider children or a pregnant woman. So even though the results are elevated at all the properties, for this, these are considered interim temporary actions. 66 of the properties are not eligible for an immediate action. This has nothing to do with when we start to look at things for a more long-term action. This would be the immediate. So those were determined because there was no vulnerable population present, low or no use of yard, And that, right now that would just be risk communication. Everybody will be receiving a letter with their results in the coming weeks. I know John in the removal program, he's working over the next couple of days to get those all mailed out. So there's 57 properties that do meet the requirements for an immediate action. So there's two types of actions that will be taken. One would be a temporary soil cover, and that would be if we have a vulnerable population present or a very high use of the yard, and EPA will be installing some sort of protective cover, and we would work with the property owner to determine what the best temporary cover would be. And that would be a thin layer of clean soil and sod on top of that, or potentially wood chips or some decorative stone. And as I said, we'll be working with the property owner to determine what the best, and it may be a combination of those as well. And then another 22 properties are going to be eligible for raised garden beds. So these properties would not have children there, but they have indicated to us that they do vegetable or flower gardening. So what we'll be doing is installing raised beds or containers with clean soils for them to be able to continue to garden and not be exposed when they're digging in the soils. So this is just our immediate next steps here. As I just said before, they're preparing the letters this week and getting those mailed out. For beginning next, it's the 12th here, but I believe John said he's going to be in East Trenton starting on Monday, and they're going to be doing public outreach to homeowners and tenants. He's going to be doing some follow-up, making phone calls to residents and, discussing the results with the homeowners. On April 25th, at the Collaborative, we are going to have an availability session. Now, this availability session is going to be specifically for residential property owners and tenants as well, to be able to come and discuss any results, concerns they have with us. But it is specifically targeted for those people that are going to be receiving a letter from us in the next few days. In the summer, it will be the installation of those temporary soil covers and the garden beds. And we'll also be continuing additional assessment work at residential properties. So if anyone has any residents that come to them and they are the property owner, they can provide us access and we can sample that. If they're a tenant, they could provide us the landlord information and we could get in touch with the landlord to try to get access to sample those properties. Our next initiative that we're working through right now is to approach again property owners in East Trenton that own multiple properties for rentals. So we have been preparing a letter that's going to go out to them. We've contacted a lot before. Some were uncertain, some did deny us access, but this letter is kind of the next step in us trying to gain what we would, we're trying to work with them still to get voluntary access before we consider what our other legal options would be to get access if we're repeatedly denied access. And then the third thing that's going on right now is the parks. So we did test the 3 main parks in East Trenton, which would be the Grant Avenue Playground, the Sunny Vereen. It's really a park, but Google says playground. But it's the Sunny Vereen Park and the Brunig Avenue Park. And we collected samples in the same manner there. We did detect elevated levels at all 3 of the parks, but only 2 of the parks had elevated concentrations at the surface. So with the Grant Avenue Playground, people generally accessing that park would not be exposed to elevated levels. It becomes a concern if people are digging in that park. But there are elevated concentrations at the surface of Sunny Vereen and Brunig Avenue. So yeah, generally we did see lower concentrations than most of the residential properties, but still elevated, certainly above our RML, the removal management level. So the proposed actions, number one is going to be risk communication. Signs are going to be posted at each of the parks, and John will be doing some door-to-door outreach at in the neighborhoods surrounding the parks. And then the second thing would be temporary cover installation, and that would be similar to the residential properties and the schools. It would be a thin layer of soil and sod on top, and or wood chips, and that would depend on the area, depend on the use, and that would be for Sunny Vereen and Brunig Avenue, because Grant Avenue does not have elevated levels at the surface. We would post signs at the park warning people to not dig at the park. So the parks, it has been determined that the parks will not be closed. These signs will go up. I believe they're going to be going up next week. And then as removal is able to start working on these parks, they'll close down certain areas of the park while they're doing it. We don't want to just close all of the green space in these neighborhoods. We know that green space is limited. So we're going to post signs. The signs will be in both English and Spanish, and we'll be doing that outreach. So we're going to be doing that risk communication, and it will have the signs will explain what you can do to protect yourself, so that we don't have to close down the parks entirely. So these are the results. I know we're limited on time, so I'm not going to go through the individual results, but just our next steps, I'll wrap things up. April through May, we're going to be doing that interim cover at Grant Intermediate. May through June will be in the interim cover installation at the parks, but the signs will be going up as soon as next week. And then May through August, we're planning to do the interim cover installation at residential properties. Throughout the summer, we'll be doing additional sampling at residential properties. And then the fall, that's when we will have completed the evaluation for eligibility for the national priorities list. And at that point, we'll be able to make that determination of whether the remedial program will be coming in and be doing a more long-term complete cleanup. And then, of course, we'll be having public outreach and community events throughout. So I'm going to go ahead and stop sharing here. Does anybody have any questions? I know we're very short on time.
I do. Couple things. So first, is it possible to get copies of the slides that you shared today? Are they public or are they internal at this point?
I believe I can, but let me just, unfortunately, John wasn't available to do the presentation today, so I'm going off of his stuff. So I'll check on that, Heather.
I appreciate that. Second, just have to go on record and say I absolutely hate the idea of artificial turf. I fought against it for years because there are so many things in it that I hate the idea of trading one set of contaminants for another, and I feel like we're just behind in having that become like another health hazard. I know it's been evaluated on some levels, but I don't think there's enough science behind it to say it's safe. So I hate the idea of that, I just want to say. But third, for the 60-some homes that don't have children currently living there that don't meet the requirements for anything to be done at this point, what happens if children move in? What if they're a rental currently not having children, and then children move in a month, and there are children present at that location where currently they're not on the list to have anything done? Is there something going to be done if children do become residents there, or is that followed? Okay.
Yes, absolutely. So what we'll do is we'll continue to monitor, and we do have language, I believe, was put in the letters that if anything changes with the use of the property to please get in touch with us. But so as soon as we have an indicator that there is a vulnerable population present, it would then become eligible.
Okay, that's fantastic. That was really my major question, because that things change all the time.
Yeah, I have a question about that same point. I think it's a large number of properties, more properties not getting immediate action than are. And so I wonder, is there a consideration for like who's living next door to that property? Because if the lead is in the top of the soil and it's not covered, is it potentially blowing next door on a property that just got covered? So is that part, I wonder, like, is there any avenue for those properties to be looked at further and or considerations like that in place?
No, there's not right now. We do not take into consideration any neighboring properties. We do consider these actions to be temporary. So unless we had a severely dry, neighboring property with absolutely no like grass coverage, in that situation, I guess there would be there certainly would be the chance for some cross contamination, but also, keep in mind that cross contamination would be extremely low levels, and the amount of time that these are going to be in place, like we wouldn't, these aren't expected to be, a 20-year temporary measure. It's more of a short term to be able to do something immediately while the site continues to be evaluated for these more long term. So we wouldn't anticipate, any major cross contamination occurring in that time. And as we said, we certainly will continue to evaluate, and this number will grow as well. We have on our end, we have it marked down at about 950 properties that have some sort of residential use in East Trenton. So we do anticipate sampling a lot more of these properties over time, but access for EPA is always an issue because we do need to get access from a property owner before we can sample a property. Unfortunately, we're not able to work off of like a tenant access as some other groups might be able to.
Thank you, Joe. If no one has any other questions, I'm gonna.
You want to move to Alex first?
I want to go to Alex for social determinants of health.
Yeah, thanks. So I'll try and keep this brief. So Trenton Health Team has received a grant from the CDC to produce a social determinants of health accelerator plan for the city of Trenton. Social determinants of health, I'm sure you all know, but these are the things that impact our health, like where you work or where you live or the food you eat or the kind of education you get, the sort of non-medical impacts on a person's health. So we have formed a subcommittee with representatives from a variety of organizations who are all part of our larger community advisory board. Sherelle is on our advisory board for on the steering committee, for the SDOH Accelerator Plan. We've also got folks from Capitol Health, Henry J. Austin, Trent Housing Authority, Mercer Street Friends, Isles. And the plan, the CDC sort of sets out some guidelines for the plan, and we've chosen to focus on two specific issue areas. One is food security and food access, and the other is the built environment. And within the built environment issue area, we really want to focus on lead. So the plan, it's a plan, right? So it's meant to cover the next 1 to 3 years with short, medium, and long-term goals for how we collectively would address lead in our communities. What are the specific actions we will take? Doesn't necessarily have to be new work. There's no money that's attached to any of this. Like, just because we put the plan doesn't guarantee we get any additional funds. It does open the door for additional funding from the CDC. So if we can get some specific actions into the plan gets reviewed and not really approved, but like accepted by the CDC, that sort of opens the door to getting some additional funding from them further down the road that could support these goals. This is why when we were talking earlier about the Hub's goals and the Hub's vision, I said I'm eager to get to the point where we're talking about the goals because we have an opportunity here to include them into this plan, which is admittedly fairly broad, but I think it's a good chance for us to sort of prioritize some actions that we might all be taking, get them on paper, and get them like recognized by the CDC as a way to sort of, one, hold ourselves accountable, but also two, like get some attention on like, these are the things that we really want to be focusing on in Trenton. So some of the things that we have already thought about including, would be some of the data work that I've been talking about before. Like, those are things that Trenton Health Team would want included. So, we want to come up with a system for targeting inspections and remediations of lead impacted homes that is built off of lead testing data or lead inspection data. Same thing with like targeted lead level screenings that would be based on data. We'd have to build out a plan for like getting access to the data, but if we can kind of map that out and get that into the plan, we think that would be valuable. We like expanding lead testing and remediation programs. Isles work, like all of that could just easily just kind of go into the plan as is. Home repair programs that also deal with remediation, mobile testing, like those are all things that we could write into the plan as a way of, again, sort of like prioritizing our collective work and also just kind of like raising it to the level of like, hey, CDC, like these are the things that we're working on and we would really love to talk to you more about potential funding for it. So, I know we are basically out of time, but I'd love for everyone to kind of think about, what are the priority actions that your programs are taking over the next like 1 to 3 years that, you think might fit into a plan like this, thinking about sort of citywide actions that we could take to reduce the risk of lead poisoning. And then talk to me, talk to Sherelle, we're like halfway through this planning process. So there's still time. We're looking to wrap this up by the fall. So there's still time to kind of talk about like, hey, we have this idea for how we're going to expand our program. Can we get that in the plan? Or like, hey, we're already planning to do this. Like, can we just write that in the plan? We can do all of that. So yeah, I just want to put that on everybody's radar.
Alex, thank you. And I know you guys that we're a little bit over, but Alex, I don't know why I wasn't thinking, because what me and Sean have been doing, we're already working on that. We're doing the testing in the homes. We're doing phase 2 now, where Sean is, can we get like 5 minutes so he can explain? This is already in progress here in the East Trenton neighborhood. We can take this and expand it out through all of Trenton and then maybe greater New Jersey. And Sean, will you want to just talk about phase 1, phase 2 real quick? Guys, if anybody can stay, please stay a couple minutes longer.
Yeah, so sure. So phase 1 was our soil testing and blood testing throughout the East Trenton neighborhood. So in phase 1 from August to November, with our community scientists, we tested 122 homes, which came out to 242 soil samples that we collected. We finished all the analysis and we provide all the residents the information back on their levels of soil, lead in soil. And now we, as Sherelle was mentioning, we started phase 2, which is where we're going back to homes with elevated lead or elevated blood. And we are measuring lead in the paint within the home. We're measuring lead in drinking water within the home, and we're also measuring lead in the house dust. And if the resident's interested, we're also measuring ceramics and spices that they have within the home.
Yeah.
So I sent Cassie the poster that we presented in February at NIHS, and she's welcome to share that with everybody. But we presented our phase 1 data down in North Carolina at the National Institute of Environmental Health in February, and now we are moving on to phase 2, and we're in people's homes doing the testing.
Yes, not only we're just doing this testing, but we're providing jobs to 15 and over to the residents in the community that's impacted by this, and they're learning. You can get a 15-year-old to tell you, because we kept asking these questions before we send them out. We want them to know. They know what drip lines are. They know why they're collecting the soil. They know about lead. So we're providing jobs, and they're learning, and they're learning how to help create changes that they want to see in their own communities. So we've been doing this already, and we're going to conferences talking about the work. Sean is going to get us an award tonight at Rutgers, and we have a big poster that lives in our office here of the work we've done with the community. So we can plan on making that go out. So, Alex.
Yeah, I mean, I'd love to hear more about kind of what the next phases look like, and think about how that fits in. We don't have to do that now, but yeah,
We don't have the
it'd be
time.
great. Yeah.
I did want to give up updates. Put a hold on your calendar. Auto Day is coming up, and the same day, the Trenton Health, the East Trees ETC will be having the Trenton Community Health Day. And with Auto Day, they put people on their radar, so they send people around to other communities that's doing something on Auto Day to see what's happening. So I'm not sure that date, but it will be in September, most likely. If anyone knows the date of Auto Day, that's going to be the date of our community fair here, health fair community. May 4th is Trenton Community Day with the Watershed Institute. We're going to be cleaning up over at S&P Creek. I don't have the correct times. Kurt, can you help me with the times? I do know it's going to be on May 4th, and I'm not sure about the times. It's going to be at George Page Park, also known as Hetzel's Field. And then October, it should be October 5th. The first week of October, as you all know, October only has an October Lead Awareness Week. I know our Assemblywoman Verlena Jackson Reynolds is trying to work on making that month, Lead Awareness Month. But the East Trenton Collaborative will be having, put the hold on your calendar, our second Lead Awareness Day and community barbecue, food, entertainment, information, a lot of information. We plan on having a lot of things for our seniors to do, our children to do. The city of Trenton does partner with us. Trenton Waterworks gave out water filters last time. So, and if anybody else wants to partner that hasn't, please do it again. And anybody else want to say anything before we wrap up?
I was just gonna say, July 17th is Lead Free New Jersey's in-person membership meeting. It's gonna be at Montclair University. This year, the morning day is split. Morning is Jersey Waterworks. I encourage you to come for the whole day. Jersey Waterworks, there's lunch, there's breakfast, there's lunch, and then the afternoon will be Lead Free New Jersey panel, and then our meetings and such. I know Sean and Sherelle will be in Pittsburgh, right? It's on my calendar. So
Yeah, the conference.
So we'll be divided in conference. So also I know there's some national conferences. I think there's a National Lead Healthy Housing Conference in Georgia. If partners are going to those, please let us know. It's just good to know that a partner, of Lead Free New Jersey is attending some of these conferences, and maybe you can come back and report back, or if you're presenting, even better, maybe help represent. So that's all we have. Sherelle's video, we're getting that on social media, so please share that. And the resources that are out there, if they help you, use them. On the website, I think I've dropped the link. And Cassie, you'll do the notes. Are you doing the notes, or is Enrique doing the notes? Somebody's doing the notes.
Well, I know I got a couple. I know Cassie.
Yeah.
And
next meeting.
Well, we don't have that, but I do want y'all to know April 25th, well, no, that's only for the people that's got their letters that EPA will be here. But we would like if our partners here, if anyone want to come out and share information with the residents, like Green and Healthy Homes Initiative, or if you'd like to, Isles or Alex, to come here while EPA done sent out the letters and they want to talk to the residents about that. We can give them information on lead. We can be there for support and resources. So that's going to be on April 25th at 6 o'clock. And I will have food for everyone, I promise.
Sorry, you missed bagels.
Oh, and so Shireen, Sherelle didn't put on that event. That was Princeton Justice Initiative, and they're going to be doing it again, I believe, this Saturday, April 27th. Is that a Saturday?
Not this Saturday. A couple weeks.
Well, a couple of weeks, but it'll be April 27th. Yeah, look at them, finished with April already. That's how the days keep going. And Princeton Justice Initiative looks for partners who want to come to share information with the residents. So that'll be from 12 to 3. If you want to come up, just get in contact with anyone here at ETC and we can help make that happen. So
Sign us up in Isles, we'll be there.
Thank you. Well, I want to thank you all for being here. So let's see, this is April, May. Do we want to set this for June? June, I like 11 o'clock, 11 to 1. And anyone has a
Thursday, because we have our staff meetings Wednesday.
Okay, so we're gonna do it in June and we're gonna do it on a Thursday
I
and
wanted to say something to this girl that's leading this meeting. Sherelle, I gotta go. I just wanted to say that was a great video. We need everybody across New Jersey to see it. I'm sorry, I gotta go. Thank you so much.
Bye, guys. Bye, Kari. So let's do June 21.
It's a Friday.
Oh, no, I meant a Thursday. So let's do June 13th or June 20th. Alex?
Yeah. Either. June 20th is 4Cs. They meet on Thursday, so maybe the 13th.
Is that okay, or the 27th?
13th, we have something.
There's gonna be
All right.
an event that.
So let's go. What about June 27th?
Yeah, and then the PRC is the 6th. The 27th would be good if that's okay with people.
Okay. Thank you, Alex.
27th is good.
Okay, cool.
Yeah.
Thank you.
All right, I gotta jump off to you guys.
Thank
Take
you
care,
for being
everyone.
here. Bye,
Thanks.
guys. Thank you.
Good afternoon.